Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, the tuberculosis outbreak in Kansas City. Infectious disease epidemiologist Dr. David Dowdy returns to the podcast to talk about the disease, the outbreak, and why it's an alarming indication for the current state of public health. Let's listen. David Dowdy, welcome back to Public Health on Call. How are you doing?
I'm doing well. Thanks so much for having me, Lindsay.
It's great to see you again, although unfortunately not under these circumstances. We are here to talk about an outbreak of tuberculosis that's happening in Kansas City. But just to set the scene a little bit, because it's been a minute since we talked about TB, tell us about tuberculosis. Presentation, how you test for it, all those details.
Sure. Thanks, Lindsay. So tuberculosis is a disease. It's a bacterial disease that's been with us for centuries. It is, the typical symptoms are fevers, weight loss, night sweats, and cough is the first thing that many people notice. It is globally, more than 10% of all people who develop TB die of the disease. But here in the United States, that fatality number is much lower. It's a disease that typically takes many months to develop, so it's much more slow growing than your average flu or something like that, but can be very destructive to the lungs, and in some cases occurs outside the lungs as well.
Who's the most at risk?
Yeah, so TB is spread through the air, so we're all at risk to some level, but we typically see outbreaks of tuberculosis in settings that include tightly crowded spaces. So we see these in prisons, homeless shelters, things of that nature, and also among people who lack access to healthcare. We also know that the TB is a global pandemic, and so we see higher rates of tuberculosis among people who were born and or spent significant amounts of time in other countries as well.
How do you test for it?
So there are different ways of testing for TB there, and it's important as we talk about this to recognize there are, broadly speaking, two different phases of tuberculosis. One is what we call latent TB, meaning you don't have any symptoms, but you can reactivate at any given time. And people with latent TB aren't contagious, we don't think, but again are at risk of developing the disease later on. And then you have TB disease, sometimes called active TB, and that means generally people who have symptoms, or if they don't have symptoms, we can detect the germ in their sputum or mucus from their mouths, and those people are typically contagious. So when you're testing for TB disease, you generally need to get a specimen of something from the lungs. So it's sputum, or we can do tongue swabs sometimes these days as well, but usually we're looking for sputum samples. Again, unless that TB is outside of the lungs. When you're testing for latent TB, this is when you're looking for the body's response to TB. And so people may be familiar with skin tests, where you put a little bubble of fluid under people's skin, or there are also blood tests for latent TB, but those blood tests are not for TB disease.
Random question for you. I lived in another country for a period of time, and I had to go through TB testing, and they gave me what I think was an X-ray. Is that one way to look for TB?
Yeah, so X-rays, you can think of them as a screening tool for TB. So if I think someone might have TB, I could perform an X-ray. It's pretty unlikely if someone had TB disease that they would have a normal appearing chest X-ray. But just an X-ray can't confirm that it's TB. It can confirm that something is going on in your lungs. But when I say tuberculosis, I mean a disease that is caused by a very specific bacteria. So if I saw an abnormal chest X-ray, then the next thing I would do would be to get a specimen of the sputum to see if it was that particular bacteria causing the disease.
Got it. Now, is there a vaccine for TB?
So there is a vaccine for TB. It's called BCG, and it's actually one of the most widely delivered vaccines in the world. It's given to infants at birth. But the thing to know about BCG is that while it's very effective against childhood forms of tuberculosis, it does not have any real effectiveness if you give it as an infant against the adult forms. And we don't know if this is because children have developing immune systems and it's a different sort of immune response, or if it's just a long-term waning of that immunity. There are studies underway to evaluate whether revaccination with BCG can cause or can provide protection in adult life. And there are also studies underway to evaluate other adult and adolescent vaccines for TB. Those studies are showing some promise, but we don't currently have widely available vaccines other than BCG. So right now, no vaccines that are known to provide protection to adults.
Okay, good. So I think we've really set the scene here. Now let's talk about what's in the news right now, which is this outbreak in Kansas City. Can you tell us a little bit about what's going on there?
Sure. So there is an ongoing outbreak of tuberculosis in a couple of counties in Kansas. So these are in the Kansas side of Kansas City, if you will. And so far, as of January 24th, I believe, there had been 67 cases counted across these two counties. It's important to realize that this has been going on for probably the past year. So this is not something that has happened all in January of 2025, but rather has been simmering over that period of time. And part of the reason for that is the time from infection to developing symptoms and TB disease is often many months. So it takes some time for the infections to occur before people develop symptoms. Sometimes then some time between symptoms and the actual diagnosis, and then the recognition that this is an outbreak going on. But there are over 60 and nearly 70 cases of tuberculosis all in these two counties, which are not all that large, which makes this one of the largest outbreaks of tuberculosis in the United States in the past 30, 40 years.
Put this into some perspective for us. What is this really signaling? Do we have suddenly a rampant spreading of tuberculosis, or what's really going on here?
So I tend to think of tuberculosis outbreaks as indications of weakness in our public health infrastructure. So the people who tend to develop tuberculosis, as we've described already, tend to be people who are not well served by our traditional healthcare system. Go in and see your personal doctor, etc. These tend to be people who are living in very crowded locations, don't have great healthcare access, etc. So we really depend on our public health infrastructure to identify outbreaks of tuberculosis and to respond quickly. And so when we see an uptick in the number of TB cases, and here we're really talking about just a small number of cases, we need our public health programs to identify those cases and run in quickly, and then to do things like contact investigation. So asking people who've been diagnosed with TB, who are the people that you've been in contact with? Who do we need to then go and test, and to get all those people diagnosed and treated as quickly as possible, including people who have that latent infection, which may not have fully blossomed into disease yet, so that we can prevent those people from getting TB in the coming years. When we're able to do that and do that effectively, we can contain outbreaks at very early stages. When things happen like this, where we have larger outbreaks, often what's going on is it may be a small number of initial cases, but then when we do those contact investigations, we realize that a large number of people have already been infected or developed disease, and so that outbreak is bigger than we originally thought. And so what we need is that underlying infrastructure to detect and get out ahead of these outbreaks before they happen.
And you mentioned before that the lag time for this is quite long. So this is a problem that's been going on for a minute.
That's right. So this is something that's been going on for at least a year, probably more like 2 or maybe even 3. And so again is suggestive. And this is not because the people in Kansas aren't good at what they do. They are. They're very good at what they do. It's just we need more of them, and we need that kind of supporting infrastructure to make it so that they can get out and find these cases sooner rather than later.
And I believe so far we know that there have been 2 deaths. Is that correct?
That's right, which is, again, about in keeping with the death rate in the United States. It's worth saying that many people don't realize tuberculosis is the leading infectious cause of death worldwide. So more people die of TB than any other infectious disease, HIV, malaria, COVID-19. So this is a disease that causes people to die, and seeing deaths from tuberculosis is not unusual, but of course it is also a tragedy and in some ways a preventable one.
Yeah, and I think that really lends itself to the urgency of the timing of our conversation right now, because you're talking about this kind of being an indicator that the public health system is not as healthy as it could or should be. And a lot of these systems are under threat at the moment and could be fractured even further. So let's put this in context of where we are right now.
Yeah, I mean, I think that this is or should be a bit of a wake-up call for us that, when our public health system is being stretched thin, when it's being stressed, if you will, there are certain things that happen that, these sort of sentinel events that provide an indication that things aren't quite right with the system. And, we're talking right as we also had another tragic event happen here, which was this plane crash in Washington, D.C. And again, what people are talking about is these sorts of events are indications that the air traffic control system is a bit stretched thin. Like we don't have as many air traffic controllers as we used to for the number of flights, et cetera. And it's the same sort of thing happening in public health. We don't have the same number of public health officials. We don't have the same, the infrastructure, the technology systems, all of the reporting systems are getting older and older. And so it's against this that we're starting to see things like this. So outbreaks of tuberculosis cropping up. We're seeing this with other infectious diseases as well. There's an outbreak of syphilis that's been going on in the United States for a while now. All of these are diseases that are the first line of defense in this country is our public health system. And when we start to see these outbreaks occurring, it's an indication that infrastructure is not quite strong enough to support what we need.
And zooming out even further, this is a moment where, the U.S. is quite involved with the global tuberculosis scene, in the research, the surveillance, you mentioned the vaccine studies, all of that. It's a moment where we're withdrawing from the WHO. So what does this mean for that broader conversation?
Yeah, so I think it is true that globally, the United States is seen as a leader in the fight against tuberculosis. Even among Western countries, rates of TB in the U.S. have historically been lower than what we see in Western Europe, in Japan, and elsewhere. And the United States has been leading the charge in research and development, as you're describing. And we're actually, again, seeing some of that infrastructure crumbling a bit. So rates of tuberculosis in the United States have climbed for 2 years in a row now, which is something we haven't seen in decades. And, not just withdrawing from the WHO, but declines in funding for TB research more broadly are all threatening the United States' kind of leadership position, if you will, in the fight against tuberculosis as a whole. And so I think that, not only is this indicative of the infrastructure in our own country not being strong enough to support the sorts of activities that we need, but it also suggests that globally, as a global community, we're not doing what we need to really effectively fight this disease that is not only the leading infectious cause of death worldwide, but also worldwide a disease of poverty, a disease of deteriorating social conditions, and in the same way, an indication of where we are as a global community.
I think a lot of people in the U.S. right now are seeing these headlines about an outbreak of tuberculosis in Kansas City, and they're probably concerned for their own health. What do you think most people need to know right now?
Yeah, so it's worth knowing that the overall risk to individual people from tuberculosis is low. TB is not the most infectious of all diseases, even though it is a very serious and sometimes deadly disease, as we've been talking about. It is also true that this particular outbreak has come to our attention, so we are starting to pour more resources into that outbreak and doing everything we can to keep it contained. But in the same way as we've been talking, I think this is also a moment where we should all step back and realize how much our personal health and the health of our families and those around us depends on that same public health infrastructure. And if that infrastructure is starting to fail, that puts us all at greater risk. Even if this one outbreak in Kansas City is not going to be an immediate threat to all of us throughout the country, the fact that it's an indication that our public health system is not as strong as it should be, and that public health system is, again, that first line of defense against a number of infectious and non-infectious diseases, I think that's where we should really be thinking that can and will affect all of us and our kids and our families.
Well, we really appreciate that perspective, and thank you for putting this whole thing in context. David Dowdy, thanks for being on Public Health On Call.
Thanks so much for having me, Lindsay.
Public Health On Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.